In his broadcast to the nation on Sunday, March 29, 2020, President Muhammadu Buhari declared that in Nigeria's fight against COVID-19, there is no such thing as an overreaction or underreaction. It is all about the right reaction by the right agencies and trained experts. For the record, below is a chronicle of some of the reactions by the agencies and trained experts under the leadership of President Buhari. All these are apart from the impressive job being done by some state governors. January 28, 2020. 1 month before the first case of coronavirus, the federal government assured citizens of the country of its readiness to strengthen surveillance at 5 international airports in the country to prevent the spread of coronavirus. The government announced the airports as Enugu, Lagos, Rivers, Kano, and the FCT. On the same day, the Nigeria Center for Disease Control (NCDC) also announced that it had already set up coronavirus group and was ready to activate its incident system if any case emerged in Nigeria. Following the development on COVID-19 pandemic in mainland China and other countries worldwide, the federal government on January 31st set up a coronavirus preparedness group to mitigate the impact of the virus if it eventually spreads to the country. On the same day, the World Health Organization listed Nigeria among other 13 African countries identified as high risk for the spread of the virus.
Dire prediction would not be about Nigeria alone, but Africa in general and most third world countries. You know, it's about being ready in terms of infrastructure, in terms of facilities. We know that Nigeria has deficit in many areas in terms of infrastructure, particularly in the healthcare sector. So that possibly would account for why such a dire prediction came from the World Health Organization. And then Nigeria also has a large population. The last estimate was 198 million, about 200 million people. That is huge for an African country. So if an African country has a huge population and it has deficit in facilities, then if a pandemic comes, you can just imagine the havoc it will wreak on such a country. So that also then accounted for preparing ahead, which we saw from the Nigerian government.
February 27. Nigeria reports its first coronavirus case. Early March, Nigeria's Minister of Health, Dr. Osaji Ehanire, announced that 60 persons who had contacts with the indexed Italian patient were under isolation, 40 in Ogun State and 20 in Lagos State. But President Muhammadu Buhari would not rest on his oars. He continued to put structures in place while taking necessary steps to mitigate the spread.
If you listen to the first broadcast of the president, he said the reaction to the pandemic is not about underreaction or overreaction, but it's about the right reaction. It's about the proper reaction from the right agencies and the right experts. So I think Nigeria was well prepared. The index case in Nigeria came on February 27, but a clear month before then, Nigeria had set up some structures preparing for what could be inevitable and which indeed became inevitable.
On March 9, President Buhari established a presidential task force for the control of the virus in the country. March 17th, Nigeria postponed the 20th National Sports Festival that was billed to hold in Benin City, Edo State, from 22nd of March to 1st of April. March 18th, Presidential Task Force press briefing, during which the federal government announced that travelers from 13 countries would no longer be allowed to enter Nigeria until the coronavirus pandemic was over. The affected countries were China, Italy, Iran, South Korea, Spain, Japan, France, Germany, United States, Norway, United Kingdom, Netherlands, and Switzerland. These are countries with over 1,000 cases domestically. The government also stopped issuance of visas from the countries. The federal government also suspended the issuance of visa on arrival to travelers from the earlier named countries, while also deciding that all travelers returning from these countries prior to the restriction will be in supervised self-isolation, monitored by NCDC and Port Health Services.
In terms of being prepared, it has helped a great deal, because we could have waited for the index case before we started those preparations. But we started a clear month ahead of the index case. So it means we were ahead of the challenge. If the challenge came before you reacted, then you will be at par with the reaction and the challenge may be overwhelming. But we were several steps ahead. One clear month before the index case, Nigeria has set up structures.
March 18th, the management of the National Youth Service Corps suspended the 2020 Batch A Stream 1 21 days orientation exercise indefinitely. The orientation exercise commenced on 3rd March and was expected to end on 30th of March, before it was suspended after just 8 days. The Nigeria Football Federation suspended all football activities for 4 weeks. On March 19th, Nigerian President's daughter, in obedience to the established guidelines, went into isolation after returning from Britain. March 20th, Nigerian government announced the closure of tertiary educational institutions, secondary and primary. Nigeria extended travel ban to 2 more countries, Sweden and Austria. Nigeria announced the closure of international airports in Enugu, Port Harcourt, and Kano. March 21st, the Nigerian Railway Corporation announced the suspension of all passenger services from 23rd of March. Nigeria announced the closure of the remaining 2 international airports in Abuja and Lagos. March 23rd, the Chief Justice of Nigeria, Justice Tanko Muhammad, ordered all courts in Nigeria to shut down from 21st of March. March 23rd, Nigeria announced the suspension of Federal Executive Council and National Council of State meetings indefinitely. March 21st, the Federal Capital Territory Administration ordered the immediate closure of shops in the markets and neighborhood centers, except those selling food items, medicines, and other essential commodities. March 25th, government announced the closure of Asaba Airport with effect from March 27, land borders from March 29. Like in other parts of the world, the global pandemic also came with huge economic and humanitarian challenges, to which the government and other stakeholders promptly responded to. March 26. CBN announced COVID-19 fund contributions by 7 Nigerian billionaires and banks. Axis Bank PLC, Nigeria's biggest lender by assets, is teaming up with Africa's richest man, Aliko Dangote, to provide treatment and isolation centers across Africa's most populous nation as it braces for the impact of the coronavirus.
Any president will be bothered, particularly if you are the president of a low-income or medium-income country like we are. Even presidents of high-income countries will still be bothered because they have to think post-COVID. There will be enormous challenges. And that is why Mr. President has now set up what he called the Economic Sustainability Committee, headed by the Vice President. They are to formulate the right policies and responses that will stand the country in good stead after the COVID-19 challenge is over.
March 26th. The federal government received 107 boxes of medical supplies from China, comprising surgical masks, protective clothing, face shields, and detection kits. March 27th. The federal government released 10 billion naira to Lagos State and 5 billion naira Special Intervention Fund to NCDC to equip, expand, and provide personnel to its facilities and laboratories across the country.
NCDC naturally needed to be funded because it's at the heart of containing the infection. And of course, Lagos is known as the epicenter of this infection. Therefore, the president gave 10 billion naira to Lagos and gave 5 billion to NCDC, apart from some earlier funds that had been made available to the NCDC. So it's just a matter of putting your money where your mouth is. If you didn't fund the response, then you will be like sitting duck, just waiting for anything to happen to you. So the country needed to fund it, and despite the financial challenges that we've been coping with, the president still rose to the occasion.
The federal government also announced the closure of the nation's international airports and land borders for 4 weeks in the first instance, to enable the country put up the appropriate policies, processes, and infrastructure to cope with suspected and confirmed cases at home without risking compounding of the situation with more imported cases. Only cargo vessels that have been at sea for more than 14 days will be allowed to dock in the ports after the crew have been tested and confirmed disease-free by the port health authorities. The NCDC announced that it will be drafting all its recent retirees back into service to beef up manpower. Furthermore, all NCDC staff and experts who are away on training or international assignments are to return immediately. Nigerian Air Force conducting an evacuation mission to bring back some of Nigerian specialists in Central Africa to enable them support the national response. March 27th, President Buhari commended the monetary policy authorities for their financial intervention to support entrepreneurs and companies. The government also gave the indication that it's looking at physical measures to minimize the negative impact of the pandemic on the livelihood of millions of Nigerians.
The Nigerian economy is 65 to 70% informal. You have that vast population consisting of people who must go out daily if they will earn an income. So if you ask them to stay indoors for 2 weeks in the first instance and another 2 weeks in the second instance, you must then give them some sort of succor. That was why the palliative came. But gladly, there was a structure which had been built starting from 2016 in the social investment program. It is still work in progress, but at least there is a blueprint, and that is what is being used for the palliative. In the second broadcast, the president said that he has instructed that those on the social register be increased from 2.6 million households to 3.6 million households. It's not 3.6 million Nigerians household, considering that a household could be up to 4, 6, 8 people. So it's a large number. It is because Mr. President cares and he doesn't want to see the people suffer. He wants to see how much, as much as possible, that he can give succor to the people. Because if people don't go out to earn a living, how then do they survive? Week after week. So, you may say it's a drop in the ocean, but it's a place to start from. It's a place to start from. Under the social investment program, you have the school feeding program, which Mr. President also directed should continue even during the lockdown. Then you have the conditional cash transfer, which he said give them 2 months instead of 1 month. And then he said release 70,000 tons of grains to people in IDP camps and many other things. He said those who should pay back trader money should have a moratorium of 3 months and not pay back immediately. So the palliatives is a basket, a basket of policies for the good of the people.
President Buhari directed the Ministry of Industry, Trade and Investment to work with the Manufacturers Association of Nigeria to ensure that production of essential items such as food, medical and pharmaceutical products continues. Government also began the process of reviewing the federal budget.
With the pandemic also came the global reduction in demand for oil. And for now, oil is the main resource that Nigeria earns foreign exchange from. Other areas are coming up, agriculture, manufacturing and all that, but they are work in progress. Our main resource to earn foreign exchange is still oil, and demand for oil has dropped. And then there was the trade war between Russia and Saudi Arabia, which further affected the market. From a budget benchmark of $57 per barrel, oil prices dropped to as low as $23, $24. So the budget had to be revised with a new benchmark of $30 per barrel. It's a severe challenge for Nigeria.
Still on March 27th, the Minister of Health hinted that Lagos State is currently the epicenter of COVID-19 outbreak in Nigeria, stating also that the Lagos State government and the Ministry of Health had scaled up their response activities as the Nigeria Center for Disease Control supports them as well as other affected states through the rapid response teams deployed. The minister emphasized that health facilities and health workers at all levels should be on high alert and maintain a high index of suspicion to give full cooperation to contact tracers everywhere. He added that while train stations, land borders and international airports remains closed, precautionary measures should be taken by federal government to protect seaports. The minister emphasized the containment strategy of social distancing, which he said had been repeatedly announced. He added that directives had been issued at national and state levels to limit large gatherings, including religious, social, and political gatherings, school events, and the likes. Contact tracing is ongoing to identify persons who had been in close contact with confirmed cases. The Federal Ministry of Health announced that it is working closely with states and the Presidential Task Force on COVID-19 to review response activities and initiate measures to protect the health and well-being of Nigerians. The Multi-Sectoral Emergency Operations Center, led by NCDC, coordinates it and other national response activities. NCDC launched a WhatsApp APL, a free-to-use service to provide a central source of accurate, verified, and current information on COVID-19 in Nigeria. The Minister of Health also emphasized that the NCDC hotline is available 24/7 and toll-free, and that various states also have hotlines that could be called for direct state-specific questions on COVID-19, while urging citizens to use them legitimately for reporting and inquiries. On March 29th, the President made his first broadcast on COVID-19, where he reeled out various steps taken by the government to tackle the epidemic. The President also declared a lockdown in FCT, Lagos, and Ogun State.
In his first broadcast, in which he pronounced the lockdown, he said Lagos was the epicenter, Abuja was following in terms of the number of infections, and Ogun, because of its proximity to Lagos, was also a state of interest. So that was why the lockdown began in those three states. We have now seen that some other governors have done lockdown in their own states without waiting for the federal government to do it. Because under the law, under the Quarantine Act, the president could lock down any part but in consultation with the governors. So some governors are doing that at their own level. And the essence is not to punish anybody, it's not to keep anybody indoor unnecessarily, but to keep the people safe. Because if you are up and about, chances of spreading the infection or contacting the infection are very high. The virus cannot come to your house, open the door and get in. No, it's only you that can open the door for it, or you can go out to get it. But on its own, it cannot come, knock your door and enter. So if you stay at home, chances of being safe are very high. Yes, if we must tackle this problem, we must take very difficult decisions. There was an EU delegation that came to see the president last week. That delegation made a donation of 50 million euros. But the head of the delegation commended the president for his broadcast the previous day. He said it was a good broadcast in which you took very bold but necessary decisions. Those decisions were necessary. If Nigerians were not going to be sitting duck before this virus, what president would just like to see his countrymen and women dying like chicken? That would not work. So that's why the lockdown had to come, and once and for all, we can tackle this issue.
On March 30th, the president followed this up with the signing of COVID-19 Regulations 2020 into law. 11 p.m. Lockdown in FCT and Lagos as directed by President Buhari and was extended 2 weeks after.
Economies can collapse and economies can be rebuilt. Businesses can collapse and businesses can be rebuilt. But once a life is gone, there's no way to bring it back. So let us strive to stay alive through this period of pandemic. It will end by the grace of God. It came and one day it will disappear. But let's stay alive. And then after it's over, we can begin to rebuild. We can only rebuild if we're alive. If we were dead, there will be nothing to rebuild again.